We are back now with Dr. Ali Hassoun, an infectious disease specialist from Huntsville Hospital.
Doctor, before the break, you mentioned we need more testing, we need more therapeutics, we need a vaccine. Where do we stand when it comes to a vaccine?
So currently there is, as you know, several vaccines in trials. There is hope, and you probably hear it in the news and from the NIH. They're hoping by the end of the year we might have a vaccine. And again, and we've said it before, it'll be very optimistic, but there is hope and push to get the vaccine by the end of the year. And that'll be really good news for us.
We are also starting to see a growing number of children and teenagers infected with the coronavirus. What are the implications of this?
Yeah, so in general and over the last several months, there's always been the impression that kids would not get infected as much as adults. But what they found over the last 4-6 weeks, no, they probably get infected as much as adults, but they're not usually symptomatic. So if they have symptoms, it will be mild. If they have any complication, it will be not as much as adults. The concern with that is children will be a source of infection and transmission to their grandparents and parents and others. So it will be definitely can be a source if a school open soon, where it can get transmitted between bigger numbers. It's the same what's happening with the younger population who's going out feeling healthy and getting exposed and then bring it to their families. So that's the main concern.
Take us out 4 months from now, the start of flu season. How is the healthcare industry preparing for that flu season combined with coronavirus?
Yeah, so I can tell you, you can prepare as much as you can, but at the same time, you're probably going to need to pray and hope the flu season is not going to be as bad as we had it with H1N1 or several years ago. Because if the flu season is going to be as bad and the coronavirus continue to cause significant problem as we have, I think there's going to be all over the world and the United States major health crisis where, you know, healthcare professional not only will have significant exposures, also, you know, you run out of facility, you run out of bed, you run out of ventilator, and unfortunately what that means, there's going to be significant mortality and death in the population.
Sobering words. I want to turn our attention now to school safety.
Tomorrow, the state school superintendent will announce the back-to-school plan. Is there a way, Dr. Hassoun, for students to return safely to the classroom amid the coronavirus pandemic?
Yeah, so I think for the school to go back, I think we're going to need to see significant reduction in the viral incidence and infections, because currently it's not suitable. But if we see a reduction over 2 to 4 weeks, I think it's possible, but they're going to need to follow all the guidelines that the CDC published, meaning apply physical distancing, put mask if needed, hand hygiene, hygiene in general, ventilation, you know, aeration. There's a lot of things that you can do. But first of all, we're going to really need to see reduction in the cases. If it's staying like that, I think it'll be very dangerous to get school open again.
Yeah.
It's exactly the same thing now. They're talking about graduation soon coming up in Von Braun Center. And I can tell you, I'm very, very concerned about this because there's significant spike. And I'm really worried about everybody attending there.
So it doesn't sound like you'd even be safe sending your own children back to school.
I don't think so. Not at the moment. Not with these cases like that.
What suggestions would you give to teachers and parents that do have to send their kids back to school because maybe per se their work situation?
So, you know, the teachers in cooperation with the parents, you know, they need to do a planning ahead, meaning if your kid is sick, please keep him at home. If any of the other kids you think have issues and problems, please communicate to us so they can check on the other kids, for example, in the school. The school itself need to have some health plan if somebody get infected and minimize larger gathering, meaning you try to make it a smaller numbers of kids getting educated on different timing. Lunchtime also need to be divided. So it's possible, but they need, again, thinking about it to minimize, big gathering, big exposures.
So Dr. Hassoun, wrap this up for us. What's your message to folks watching right now?
You know, I really think it's very, very important to understand how serious is this. You know, we seeing significant rise, and this is going to continue if we don't pay attention in the community. The community is essential to help us to cut down on this by following these small steps, like I said. Please stay at home if you're sick. Please, if you're exposed, avoid gathering. And then follow the mask if you close spaces in gathering. Physical distancing, please do it. Otherwise, your loved one, and it's not just your loved one, every human being lost is a major problem. We're going to need to think about that in our community.
Dr. Ali Hassoun, as always, thank you so much for your time and your insight tonight.
Thank you so much.
Stay with us. We'll be right back.